Country profile, Germany. Some general information about Germany. Its government is a federal parliamentary republic. Its capital is Berlin, with the financial capital being Frankfurt. Its current president is Frank-Walter Steinmeier. It is divided into 16 constituent states. Its main language is German. Its GDP per capita is 54,000. It is a high-income country, and its population is almost 83 million.
There are several major historical events that shaped modern-day Germany. The influenza outbreak of the mid-1800s, World War I, World War II, the 1949 creation of the German Democratic Republic East and the Federal Republic of Germany West, the 1961 construction of the Berlin Wall, the 1969 tearing down of the Berlin Wall, and recently the 2015 to 2016 asylum seekers from the Middle East. Timeline of healthcare. 1388, the foundation of the University Hospital Heinsberg. In 1883, the Health Insurance Act is adopted, beginning the National Social Health Insurance, which is considered to be the first in history. In 1911, after the REACH insurance code is introduced, health, pension, and accident insurance are integrated under one set of laws. In 1933, under the new rule of National Socialism, financing and supervision of the health insurance funds are altered. Introduction of health insurance for pensions. 1970, a socialist model healthcare system was adopted in East Germany and a self-administration in West Germany. In 1990, after German reunification, Unification Treaty rules that federal German health insurance laws apply to new East Germany.
Cultural norms in Germany. Over 95% of the residents in Germany speak the German language, whether it is the standard German or any of its dialects. Clothing. Each region of the country has their own traditional costumes. For example, in the state of Bavaria, the traditional costume for men is leather trousers that end just above the knee, while for women it's a dress that incorporates a bodice, blouse, full skirt, and an apron. You can see people wearing these costumes, especially during carnivals or festivals. However, today, the average German dress is typically Western. Both men and women wear dark, simple suits and shirts in business contexts. Religion. 65 to 70% of Christians, 29% specifically identify as Catholics. 4.4% are Muslims, and 36% do not identify with any religion. Funerals are typically 3 to 4 days and are highly regarded. Sports. 27 million Germans are members of a sports club, which is estimated that is out of 82 million people in Germany.
Germany has a population of 300,000 Roma and Sinti, which is the Gypsy population, 30,000 other refugees from Romania, Slovakia, and Yugoslavia, which is the non-Gypsy population, and 1 million refugees and undocumented immigrants of various Middle Eastern origins.
Major industries within Germany include iron, steel, coal, cement, chemicals, automobiles, shipbuilding, and textiles, many of which of these products go into other industries.
The German economy is the fourth largest economy in the world and Europe's largest. It is a leading exporter of machinery, vehicles, chemicals, and household equipment. The unemployment rate is 3.8%, and it's 16.7% below the poverty line.
The current 2019 population of Germany is around 83 million people. The life expectancy at birth is 81 years, which is one of the best among the most economically developed nations. The graphs show two major differences between the population breakdown in 1960 versus 2019. First, there is a significant disparity of people over 80 years old, with 6% of the population being 80 plus in 2019 versus only 1.5% in 1960. Second, in 1960, the fraction of children and adults were more equivalent versus in 2019, where there's a larger fraction of adults making up the population rather than children. This is because the death rate is greater than the birth rate. Thus, the population is aging and decreasing, also causing the bottom of the population pyramid to become concave. We will later see how the demographic transition poses health issues for Germany.
Education in Germany. Early education is optional education, care from 0 to 6 years of age. Preschool education is largely offered by privately owned daycare centers. Primary and secondary education are compulsory. The core objective of German primary education is development of essential understanding, skills, abilities, and key competencies among pupils. There are two primary school systems, 5 days a week or 6 days a week. The progress of the students is measured on a scale of 1 to 6, 1 being very good and 6 being very poor. There is no end-of-term exam, however, the students instead must have reached the gradual target outcomes. Secondary education is separated into lower level and upper level. The lower level is offered to students aged 10 to 16, and the upper level is offered to students aged 16 to 18. Tertiary education, also called higher education, is equivalent to college. There are public and private options, however 90% are public universities. Some statistics about education in Germany is that 86% of the country's 25 to 64 years of age have obtained at least an upper secondary qualification, and 48% enroll in vocational programs.
In regards to ethics in healthcare, Germany treats health as a human right. The federal government pushes for enforcement of the right to clean water and sanitation. It is clearly mandated in Article 1 of the German Basic Law. Human dignity shall be inviolable. To respect and protect it shall be the duty of all state authority. Germany acknowledges inviolable and inalienable human rights as the basis of every community of peace and of justice in the world. In terms of equity, Germany has a long history of producing high-quality medical equipment with an emphasis on diagnostic imaging, precision medical and dental instruments, and optical technologies. In terms of accountability, everyone covered by statutory insurance has an equal right to medical care and continued payment of wages when ill, regardless of their income and premium level. In terms of transparency, Spiegel, a highly recognized German journal, compiled German healthcare information into a database. The database can be searched in several different ways, including by zip code and city. However, there were some shortcomings, such as when the sums specified did not match up with the listed payments. Some addresses were also partially incomplete, making it so that individual points on the map are not always entirely accurate. And in terms of participation, the German state sets conditions for medical care, and the further organization and financing of individual medical services is the responsibility of the self-governing bodies within the healthcare system. Germany has committed to conduct a transparent external evaluation of their ability to find, stop, and prevent health threats. No data are available at this time. While their commitment to preparedness is encouraging, the world does not have a good way of knowing whether Germany is prepared for an epidemic. However, there has been a steady decline in the probability of premature death over the past few years.
Germany is the second biggest donor in relation to the MDGs after the US. Germany uses its income generated to help with the adaptation to climate change and improving energy access. Additional aid going to Africa with the intent to double the aid being sent there. Much of the funding is going towards HIV, AIDS, and malaria treatment to improve overall health. Funding is also used to develop the Debt to Health Initiative, which cancels debt for countries putting money into their own health initiatives. In the area of education, there's a focus on the elimination of gender disparities within schools. This includes improving the ratio between men and women in schools and increasing literacy rates. Germany's federal government made the German Council for Sustainable Development to promote the SDGs. This organization focuses on the younger generation in developing sustainable programs, the overall goal being the improvement of global conditions. This includes the fighting of hunger and extreme poverty. Other focuses include the promotion of fair trade and global job opportunities, including providing livelihoods that are more sustainable. The German government focuses on the development of opportunities for the future generation. This includes promoting climate conservation and the adaptation of preservation of natural resources.
The graph on the left depicts the distribution of causes of deaths in children under 5. The top 3 causes are congenital anomalies, prematurity, and other causes. The lowest are measles and malaria. The graph on the right compares the mortality rate of children under 5 and the maternal mortality rate of Germany to the rates of the WHO regions. As you can see, Germany rates fall well below the WHO rates.
Social determinants of health are determined by a variety of factors, including occupation, religion, age, education, capital, residence, and income. In the German population, 77.4% of people live in urban regions. Most people within the country get 17 years of education. Most people choose to work in engineering, healthcare, IT, and business. Within the country, there are a few vulnerable groups, including those who come into the country seeking asylum, unaccompanied children, and people of the LGBTI community.
These two graphs depict the global burden of disease and mortality causes in Germany. It should be noted that the top two causes for each graph are cardiovascular diseases and diabetes and cancers.
Germany has three significant health issues. The largest is healthcare for Syrian refugees. Angela Merkel's 2015 policy allowed Syrian refugees to seek asylum in Germany, which drew millions of people of Middle Eastern origin. These individuals are not citizens, thus not eligible for government health insurance, only emergency room visits. Most cannot afford private health insurance and thus have no chronic care options, so they repeatedly visit the emergency room instead. Most cannot afford even such visits, so the hospital is not paid. To offset costs, the hospitals increase costs for citizens. This creates a dilemma for the government as to how to provide refugees with care but not raise prices for others. One solution is to hire medically trained and German-speaking Syrian refugees as healthcare workers, which will qualify them for government insurance and give them meaningful jobs to increase their financial status. This would also provide more health care workers in the industry. Second, with the population aging and the increase of non-communicable diseases like dementia, which require extended care, there's less physicians and hospital beds available. With less physicians comes less productivity in healthcare, decreasing revenue, thus less health funding, which lowers health quality. Worsened health means productivity lessens even more, thus creating a downward spiral. Finally, a major measles outbreak in 2018 targeted Europe greatly, with 600 new cases in 2019 alone. Many people did not have access to vaccines and relied on herd immunity to not get sick. Tension grew between the government, public, and anti-vaccination communities in the wake of surrounding nations imposing mandatory vaccinations. Many pled for mandatory vaccinations for months and access to it until in 2019 the government finally allowed it. Despite this, the measles epidemic will continue to grow as people have time until 2020 to get vaccinated. This issue sheds light on the importance of disease prevention, especially in childhood, where requiring of major vaccinations is only at 93%. As discussed earlier, like Syrian refugees, many indigenous people and undocumented immigrants are unable to receive statutory health insurance like citizens, only emergency room visits covered under Social Security. They cannot afford private health insurance to get any sort of chronic care, which leaves them at a health disadvantage and susceptible to untreated issues. Rural areas are also prone to health disparities, especially in elderly populations. Rural areas lack physicians for the demand, and the elderly are too frail to move closer to the city for care. The demographic transition is lessening the amount of living younger relatives who can take care of the elderly. With a predicted 20% drop of the overall population and 30% drop of the working age population through 2035, this leaves the rural areas susceptible to decreased productivity, weakening economy, lesser health funding, weakened health programs, which all massively decrease the health standard. Low SES areas have similar issues. Areas with little education, high unemployment, and low median income report lower health consistently, especially among men. With no public resources or comprehensive public policies to help reduce this, health in these areas continue to deteriorate. Germany spends 11.2% of its GDP on health, with $4,500 spent per capita. Health insurance is mandatory. Statutory health insurance is the public health insurance, mostly government funded, and the most popular health care option. It is mandatory for people earning less than $71,000 a year with no extra cost for non-earning dependents. People earning more than this can choose to have this insurance, but they must pay 14.6% of their wages, split evenly between them and their employer. Private health insurance covers 11% of the population, mostly among the self-employed. Private health insurance boasts better services, but people must pay premiums depending on their risk, which is regulated by the government to prevent excessive rate increases. Non-citizens are not eligible for SHI, but are covered by Social Security for emergency room visits. Visitors, part of the European Union, however, have subsidized visits and get some coverage. Out-of-pocket costs are 13.2%, mostly spent on nursing homes, medicine, and medical aids. Copays are 5 to 10 euros per visit, except for people under the age of 18. Germany boasts 30 university hospitals. Tertiary level facilities like these require physician recommendations and have long wait lists. Secondary level specialized hospitals are very similar in this manner, but these hospitals offer different care packages which may or may not include patient gowns, private rooms, or other amenities. On the primary level, there are 4.21 general health physicians per 1,000 people. These professionals work at family clinics but also at secondary hospitals to provide more specific care. Germany's world-acclaimed hospitals provide vast specialization and low cost of procedures. Thus, the medical tourism industry is growing. However, it contributes to the growing waitlist and physician shortages.